In today's class, we will study the laxative drugs. This comes under the pharmacology subject. This is one of the most important topic in pharmacology. The first of all, we will study the how the this term laxative is originated. It is originated from the Latin word laxar. From the laxar, the equivalent English term is to loosen. Means the laxar means lax or loosen. That is term it is commonly using in the constipation. If the patient is suffering from the constipation, then these class of the drugs we are using, laxative drugs or the stool softener or loosening drugs we are using here. The laxative are the drugs that facilitate bowel evacuation by softening stool and promoting intestinal motility. Simple meaning is that the laxative are the drugs that facilitate the bowel evacuation by softening the stool or promoting the intestinal motility. This is called laxative. Now the next thing is the definition here. The definition is laxative are the drugs that promote the defecation. Simple meaning it is promote the defecation and relieve the constipation. If the patient is suffering from constipation as well as the promote the defecation. How? By increasing the stool bulkiness and softening of the stool and stimulating the intestinal peristalsis. Simple meaning is that the drugs which stimulate or promote the defecation and relieve the constipation by in the three steps. That is, one is the stool bulkness, increase the bulkness. Second one is the softening of the stool and also stimulating the intestinal nerves or else intestinal flora. Those drugs are called as a laxative drugs. Now the mechanism of actions, the how the these laxatives acts. There are five mechanisms of action. Anyone that follow the drug, then it will act as a laxative. The laxative act by one or more of the following mechanism here. The common is increasing the fecal bulk. Some drugs are increasing the fecal bulkness. Whenever we are taking the some seeds or isabgol, that looks small. Whenever it will go enter to the intestine, it will become swollen and the person feels the bulkiness in the abdomen, the intestine will be full. That is the bulkiness. Second one is the retaining the water intestine. It means that the intestine not allowed to expel out. The intestinal water is retained. That's why the water quantity is increasing in intestine. Due to that, the some drugs acting as a laxative. The next one, the softening of the stool by adding some fat or some water or some oiliness inside the stool becomes the soft. Due to that, easily it is expel out and evacuate. This is the next step. Next, another method of mechanism of action is stimulate the intestinal motility. No, that is the intestine. In that it is continuously peristaltic movement it is there because of the nerves in the intestine. This stimulates or irritate. Some drugs are irritating or stimulating the nerves of the intestine. Due to that, the intestinal motility increases, peristaltic movement increases. That's why the acting fast and evacuate easily. This is the or expels out the fecal easily. This is the next step. Another one is the lubricant fecal mass. This is the fifth class of the drugs. Here, the instead of that mixing the liquid or water or fat, the outer layer only the lubricating, the stool outer layer lubricating and expel out. It becomes the stool becomes smooth and easily expel out. In this lubricant, the fecal mass is lubricant and expel out. These are the five mechanism of actions that laxative drugs it is acting. Based on that, the here the laxatives are classified into five types. The first one is the bulk forming laxative, second one osmotic laxative, third one stool softener, next fourth one stimulant purgative, the fifth one is the lubricant laxative. Based on the mechanism of action, the laxatives are classified into five types. One by one we will study. The first of all, the bulk forming laxative. These are common drugs are that is Isabgol, Bran or Methylcellulose. These drugs, how it is acting by increasing the bulkness. The simple mechanism absorb these Isabgol whenever it will go to the intestine, absorb the whole water, absorb the water. These absorb Isabgols. After that, it becomes the swollen, the full, then increase the stool bulkness. The person or the patient feels the fullness in the intestines, increase the stool bulkness, and after that the stimulate the peristaltic movement. Due to that, the patient feels the stimulation to pass the motion, that is the peristalsis. This is the method or mechanism of action this class of the drug is using. The common example is Isabgol Husk, very famous Isabgol brand. It is available like this. These are the mechanisms of action of this class of the drug. The second one is the osmotic laxative. In this class of the drug, the drug is not allowed to expel out the water. That means hold the water inside the intestine or increases the water quantity. Due to that, it acts as a laxative. The drugs commonly Lactulose or methylene glycol or magnesium hydroxide, magnesium sulfate. These class of the drugs, the mechanism of action is retain water in the intestinal lumen. In the intestinal lumens, these are hold the water. That is due to that the stool becomes soft and easily evacuate. This is the mechanism of action of the laxative. Common example, the brand available in the market or medical shop is the Duflac. Duflac is the common, or Pleglac is the common brand available in the medical, that is acting as a osmotic laxative. The next one, fourth one, is the stool softener or emollients. These class of the drugs are common drugs are that is doxalate sodium or doxalate calcium. Mechanism of action here, this softener is the increasing the water penetration into the stool. What it is doing, the stool inside the increases the softening by mixing the water or fat or oil inside the stools. Due to that, the stool becomes soft. Here the softness of the mass, here due to that, that will easily pass out or expel out. This is the mechanism of action of the softeners. Very common examples are the capsule smooth is very commonly available in the medical shop. The next one is the stimulant purgative. Purgative means strong, forcefully evacuating. This is the called purgative. Here this is the, in the laxative, this is the fourth class. Stimulant means stimulating or irritating the intestinal nerves. Due to that, increases the peristaltic movement of the intestine. Due to that, the intestine acts fast and expel out the fecal matter. This is the method. The common one is the bisacarols, senna, castor oil or sodium picosulfate. These are the drugs. How it is acting? Stimulating the intestinal nerve plexus, and due to that increase the peristalsis and rapid bowel evacuation. This is the example is Dulcolax or Dulcolex is very common brand available in the market. Almost all surgeries, before surgery, for preparing the surgery, the common laxatives we are using this one, Dulcolax tablet. 2 tablets we are giving before any surgery. This is the stimulant. Next one is the fifth one is the lubricant laxative. This is the last class in the laxative. The lubricant means that stool, it is not mixing the water inside the stool, that only it is a lubrication. Outer layer only, the covering of the soft, the lubrications it will make. Due to that, easily pass out. The drugs are liquid paraffin and mineral oils. Mechanism of action, the coating of the stool surface. The whatever the stool inside it is there, it will become coating or covering that. These class of the drugs form the coating. Due to that, reduce the water loss. The water is loss is reduced and facilitate stool passage easily. This is the lubricant laxative. Very commonly available brand in the pharmacy is the Crimafin. Commonly we are using in almost all the piles, fissure patients, Crimafin brand we are using. This is the lubricant. These are about the 5 class of the laxative. Next one is the therapeutical uses where we are using the laxative. The first is the constipation. If the patient is suffering from the constipations, then This is the laxative we are using. Next one is the bowel preparation before surgery. Just now I told the Dulcolax tablet, that is a stimulant purgative we are using before surgery, that is bowel preparation before surgery. Next one, third one is the preparation of the before colonoscopy. This is the one of the diagnostic procedure. Before we have to do the colonoscopy, we are giving the laxative or Dulcolax tablet before colonoscopy. The next one, the hemorrhoids, anal fissures, these diseases also we are using the laxative. The next one, hepatic encephalopathy in the due to the liver problem, due to the abnormalities in the liver or the last stage of liver, the hepatic encephalopathy, the ammonia increases inside the body and it will goes to the brain. That is called hepatoencephalopathy. In that cases, this is ammonia is one of the toxic substance. The patients, due to that complication, it may go to the shock, that is unconsciousness. To avoid this one, we are giving this class of the drugs, that is laxatives. We are using to reduce the ammonia or expel the ammonia in the form of the laxative we are using and expel the ammonia. This is the method we are using in the liver diseases also, that is hepatoencephalopathy. The next one is the adverse effect. What are the adverse effect? It is this lactulose. Due to the lactulose, the fluotinase, this is the gas is formed inside the abdomen, common adverse effect. Next one is the abdominal cramps are there because of lactulose. Next one, magnesium salt. If you are giving magnesium salt laxative, the common adverse effect is electrolyte imbalance as well as the hypermagnesium. You can see the next one, bisacodyls. The bisacodyl abdominal pain, you can see the complication, as well as if your dose is increasing, then diarrhea is also very common. Liquid paraffin, anal leakages are chances are there, as well as the reduced absorption and fat soluble vitamin. The next one, senna, if you are using abdominal cramps and melanocytic oil and chronic pain inside the abdomen. This is the adverse effect. Next one is the advantages. Advantages here, the effective relief from the constipation. This class of the drugs, laxatives, very effective in the constipation. Next one, prevent the staining during defecation. Whenever the person is passing with forcefully, that is expelling the motions or passing the motions, in that cases, this is preventing the straining. The stool becomes soft and easily expel out. This is the preventing staining during the defecation. This is the one of the best advantages. Next is the use before diagnostic procedure. Just now I told in the colonoscopy, this class of the drugs we are giving. Next one is the disadvantage. What are the disadvantages if you are continuously using the laxative? The common is electrolyte imbalance with the prolonged use. If you are continuously so many days you are using, the chances are the electrolyte imbalance because the increase the expel the water or electrolyte from the body. This is the one of the complication. Next one is the dependence with the stimulant laxative. If you are using this class of the drugs, suppose the stimulant Dulcolax biscodyl tablet, if you are using for a long time, then the patient is become he is become or person has become the addiction of that tablet. Whenever the tablet take, then only he will pass the stool. That is the one of the complication. That is the dependency increases if you are giving stimulant laxative for a long time. The better one is to change the class. Suppose if you are giving long term stimulants, better you have to shift to the another bulk sometimes and osmotic laxative sometimes. This is the method. It is the shift you have to the another class of the drugs. This is the common complication seen in the dependencies increases. The next one is the abdominal discomfort. If you are using the laxative drugs, you may see the abdominal discomfort in the patient. These are the disadvantages. Now lastly, the common brands available in the pharmacy. The common laxative available in the medical shop is the commonly the Psyllium Husk. Very common is the Psyllium Husk, that is the Isabgol. Isabgol is very famous brand. The almost all the medical shop it is available. Next one is the Lactulose. Duflac syrup is commonly available in almost all the pharmacy. Next one is the this Polyethylene Glycol. Peglac is commonly available. Bisacodyl, almost all medical shop before surgery that is using the Dulcolax tablet, Dulcoflex tablet. Lastly, the Senna, Sencote is the common brand available in Indian pharmacy. This is about the laxative. Hope you understood the today's topic. If you understood, please share to your classmates, friends. If you understood, please like, share and subscribe. Thank you.